Developing the Middle Manager is our episode topic. Rejoining us as guest is Dr. Jim Ballinghoff, Chief Nurse Executive at the University of Pennsylvania Health System and Assistant Dean for Clinical Practice at the University of Pennsylvania School of Nursing. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Jim, thank you so much for joining us today.
Thank you for having me.
Last year in Season 3, Episode 4, you talked to us about advanced nursing practice with technology. Later on that year in Episode 24, you talked to us about your perspective as a Chief Nurse Executive on healthy work environments. But today we're here to talk about developing the middle manager. Can you talk a little bit about your leadership structure? Is it a traditional assistant nurse manager, manager director, CNO model, or?
It's the traditional model. Some areas, larger areas, will have assistant nurse managers. Some areas will have an associate chief nursing officer, but otherwise it's nurse manager, director, CNO.
And then from a span of control perspective, what other resources exist at that unit level to support the manager? Are there, for example, clinical nurse specialists, nurse educators? What's that? If I'm a nurse manager over a unit, what's my resources look like on that unit?
It is somewhat different at each of our hospitals. It's one of the things that we're attempting to do as a system is to standardize, and especially when it comes to titles, things like that. But I would say for our traditional system, which was the 3 downtown hospitals, we, at each of the units, we have what we title as a practice leader at this point. And to qualify to be a practice leader, you could be a clinical nurse specialist, which is title protected in the state of Pennsylvania. That's why we specifically don't call them clinical nurse specialists. They can use the title, but there's not enough of them to fill all of our practice lead roles. So we will also have master's prepared educators, master's prepared clinical nurse leaders, all filling that role of practice leader. And they don't report directly to the manager. It's almost like a leadership dyad for the unit, but they're a huge support for that manager.
Excellent. And then I know I'm going down the rabbit hole a little bit, but I'm interested in the topic while we're talking about it. You said you don't have enough clinical nurse specialists. As the CNE of the entire health system, are there any strategies to building more CNSs available in the market? Or what are your thoughts around that?
It's really dependent on the schools, the programs who produce that particular area. And you'll see enrollment going down for that because not a lot of hospitals are hiring into that role. We promote going to programs that specifically offer clinical nurse specialists. We have great tuition support benefits here. But beyond that, it actually, I think it actually works well the way it's set up because it gives a diverse background. That clinical nurse leader, there's some of our local universities have those programs. They're more focused on quality, safety. They bring something different to the table. The master's prepared nurse educator brings something different to the table. And then you have the clinical nurse specialist perspective. And them all working collaboratively as a team, really being able to share those expertise and that diverse skill set, but then working under the umbrella of practice leader. I think it in some ways is beneficial.
Excellent. Thank you for sharing that. Our topic today is developing the middle manager. So when we're thinking about the title or not really title, but the role of the middle manager, who are we really talking about for the purposes of this episode? When you think of a middle manager, is that the nurse manager because they have assistant manager? Is that the director? Who are we thinking about in this concept?
I think for us, and the way I would describe it at our organization, it would be the director level.
Okay.
However, as we bring smaller organizations into our system, we'll see that that sometimes is defined differently depending on the size of the organization. And there are small organizations where the manager also has some responsibilities that would equate to the director level at other organizations. So I think in a smaller organization, you might consider them middle management. For our larger entities, I would say what I'm going to speak to is more at the director level, meaning that they have managers who report to them who have direct frontline responsibility. There are also falling into that category are director level positions who might not have managers who report to them, but they have a level of responsibility that could be equal to a clinical type director position. Maybe they have a service line responsibility, but to get to that level, they've had to have some sort of leadership experience or whatever, but might not have a manager who reports to them to say that it's a middle management position.
And so, at a high level, what does leadership development look like in your organization?
It's definitely multifaceted and it's both specific to the leadership level, but also combined. So we might have development opportunities, programs that are specific for a manager, specific for a director, specific for a CNO. But then there are times where we'll bring them all together for a particular topic or opportunity where they can be developed further, particularly when you're thinking about some of the newer areas that most of us don't have familiarity with. And that's about virtual care, artificial intelligence, those types of things. So we might bring the whole leadership team together to develop them at one time.
And then, more specifically for the middle manager, those individuals that are in director levels, what does development of that individual look like within your organization?
It's definitely very different than developing a frontline manager. I think for frontline managers, you're really thinking about standardized competency-based trainings that are going to give them a foundation or a skill set that to make them successful as a leader, something that they'll build upon as their career grows. For middle management, I think that's a little bit more individualized, and that could be it could be self-promoted, it could be their own personal interest, it could be identified during the evaluation process, and that can come in many different forms. It could be sending them to conferences for development, having them attend webinars, certification programs, online courses, as well as advanced degrees. I also think at this level, mentorship is important because these folks have had some sort of leadership experience. And because of their successful leadership experience and their skill set, maybe their education, they were promoted to a higher level position. So they have that foundation that I described. Some folks might want another advanced degree, or someone might have an interest in quality and safety. Someone else might have a focused interest in innovation, something like that. So I think it gets a lot more individualized when you get to that level.
Excellent. And so, is there a gap analysis that the CNO is doing with the director to identify maybe what those growth opportunities are? Is it based on the mentorship that there's a formal mentor-mentee role and the mentor is developing and figuring out where this person has opportunities? You talked about individualized, but how do we get there?
Yeah, I think everything that you described, it could be just a leader recognize a CNO recognizing an opportunity in their director. our evaluations are geared towards identifying opportunities, both at the self evaluation level as well as for the CNO who's evaluating them. It could come throughout up from that. It could come out of just in a project working together and seeing that there might be either an opportunity or an interest, or you see a spark in somebody that you'll say, hey, this is an opportunity. And then through dialogue with that individual and finding where their interests lie, we don't push people into things that they're not really interested in unless it's a skill set or something that they really need to develop, or it was an opportunity that was identified through an evaluation process.
Do you see common themes in opportunities or growth development content that leaders need as they transition from that frontline leader to the middle manager? That even though we have individualized education in your organization, that, hey, there's this common theme that I know that all of these people are going to need as an area of focus.
Emotional intelligence
Okay.
is an opportunity for all of us as we go, whatever level we're on, because at each level, we're going to experience different interactions, different scenarios where that particular skill set would benefit. We would benefit from that. There's also, with the evolution of our industry and where we are, I described earlier, artificial intelligence, virtual care type models, virtual reality learning, simulation. All of those things we have a lot of managers who've been managers for a while or directors for a while who didn't necessarily get exposed to some of those types of things. We're also dealing with different things in this industry that we didn't deal with years ago, and violent and aggressive behaviors. Not only thinking about the skills you need for de-escalation training or interacting in a scenario that could be very tense there, but also thinking about how are we caring for the caregiver? How are we caring and working with our folks who may have had these experiences, but we didn't have that experience? And I think a lot of those things can be relatively new for a lot of people.
AONL talks about leader competencies within the three categories of the science, the arts, and the leader within. Now, at the time of this recording, the nurse manager competencies and the director competencies were being revised and updated, and the AONL website right now lists it as coming soon. But with that in mind, thinking about the current domains and the current competencies that are listed, can you talk about how you develop your managers to manage the business?
Providing education, educational opportunities around defining care models, what care models look like, how care models are evolving, how technology is changing our care models. Also, they need strong financial acumen skills. That is always an opportunity for folks, particularly you may get exposed to it at the manager level, and you may not. You might have financial support that does a lot of the analysis of your data for you. So that's always an opportunity there. And as you take on, you typically, when you go from manager to director, you have that management experience. But that management experience may be for one area or one unit, and now you have multiple units or multiple areas, and the finances could be very different in those areas, could be measured very differently. That's a skill that you continually need to develop. Understanding key metrics that drive the business, length of stay, productivity, all of the different areas that might impact those areas or impact your business, access into your organization, what access means for your organization or lack of access to your organization, how all of those things tie together, impact the business in different ways. Or it could be just external forces and what's going on from that perspective and how you think about those external forces infiltrating into your organization or changing the way you do things in an organization.
The next is leading the people. Obviously, these middle managers have already had experience, in many cases, having FTEs that have directly reported to them that are frontline staff, but now they're managing managers. And so, what does that look like when you're transitioning a leader to that role and developing them as a leader of people, but really a leader of other managers?
Communication style, understanding your communication style, understanding how your communication style impacts others. You are um, emulating and developing leaders underneath of you. So it's really critical that you have a strong skill set in that area. When I mentor frontline managers, I always tell them, one, cut themselves some slack, because particularly in that first year, because you learn a lot about yourself. What do you react to? How do you communicate? Things like that. But as you grow and move along, you'll refine those skills. When you get to that middle management or director level position, you really need to have an effective communication style. Emotional intelligence, like I described earlier, that's really important. It's important that you're remaining calm, that you're taking the time to really think about your responses, those types of things. Whereas when you're in a frontline management role, you're still developing those skills. You're still learning who you are. You're going to make mistakes along the way. Not that you wouldn't make a mistake at the middle management level, but you're really defining at that level. When you get to that director level, there is some expectation that you have some of that. And then there's creating culture. How do you, as a leader, particularly when you're over multiple areas, how do you influence the culture in your area? How do you change culture if your culture is slipping in a negative way, or you might even inherit a negative area and you want to build that culture? So that's really important. Also, I think leading through adversity and those challenges, and we're facing unprecedented challenges in many different ways. Our populations are more complex, mental health, opioid disorders, all of those things that are different, and there's heightened tensions around those things. But as a middle manager and one of the more visible leaders in the organization, you need to have that skill set of leading through adversity.
And then lastly, creating the leader in yourself. So a lot of discipline there and staying motivated and self-development. Is there anything particularly that you do as a leader, a chief nurse executive, and developing that middle manager about providing time for self-reflection and having them continue to focus on creating that leader within themselves?
Whether mentoring or educating or just speaking about different topics and opportunities, I always encourage folks to recognize and identify where they have opportunity to develop their skill, because we're all strengths and we all have opportunities. And if you look at all your middle managers across your organization, you're going to be able to say which ones have which strength. We're not all going to have exactly the same thing, but what you can do is to find those areas where you are uncomfortable, where you don't feel you're as proficient as you would like to be, and then lean into them. For me, when I became a middle manager, public speaking was not an area of comfort for me. And I found myself having to do it more and more. And in the beginning, I found myself avoiding those opportunities. And I had a great leader above me we had discussions about it and said, you really need to put yourself out there more. So start at the local level, and that whatever it is that you want to develop in yourself. Start where you're comfortable in those, whether it's your organization, or maybe you'd feel more comfortable outside of your organization where they don't know you, and then build upon that. And that's what I did. I started taking more opportunities within my organization to get up and publicly speak. And then I submitted to present at conferences and eventually just build upon that and every opportunity that comes along the way. And to this day, I wouldn't say it's my area of comfort. I do it. I think I've gotten pretty good at it, but
Well, I appreciate you being on this podcast then.
it's not something I run to,
Yeah.
but I get better and better. I think I get better feedback each time and my comfort level goes up. And you can apply that to public speaking. You can apply that to a financial skill set, communication style, all of the different skills that you need as a leader.
So as a chief nurse executive, how do you know that your development tools that you're using are being successful? What does that look like where, you've got responsibility over multiple different hospitals within your organization? And how do I know that my middle managers are being developed effectively by the CNOs in their respective sites?
As I described earlier, a lot of this can be individualized. It's really whether it was self-identified or through that evaluation process. So you'll witness that growth in that particular person, that leader. And when you witness, it's very rewarding for us to see folks develop and become more polished in areas, more comfortable in areas, being able to speak to something with confidence, those types of things. I think you'll also see it where you'll see projects get executed in a way that you can tell that development that we provided them gave them that skill, that confidence to be able to move that project through to fruition in a different way than what they had prior to. You could see it in outcomes, and maybe it's engagement scores or safety surveys. There are lots of different ways that it can be dependent on how that person was developed, what that opportunity was. But for me, I want to see that particular thing. And like I said, when you do see it, it's rewarding. Also, the feedback directly from the person. How did they feel after going through whatever that is, a program, a certification, whatever? Do they feel more confident? Do they feel like their skills have expanded? From evaluation to evaluation, we look at our previous evaluation. We look at those goals that were set or those opportunities that were put in that evaluation. Did those change over time?
Developing the middle manager has been our episode topic. Jim Ballinghoff, thank you again so much for your time today.
Thank you for having me.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.